afternoon, everyone. Thank you for joining us for today's conversation on military veteran suicide prevention. My name is Cherie Tham. I'm the co-founder and vice president of programs and initiatives at America's Warrior Partnership. We are currently overseeing Operation Deep Dive, a community-based veteran suicide and non-natural cause of death prevention study taking place in 15 states across the country, to include South Carolina. It is led by our team at America's Warrior Partnership and researchers from the University of Alabama, with the generous support from the Bristol Myers Squibb Foundation. Today, we're focusing on South Carolina. Our goal is to help viewers understand the best practices and resources available to help prevent suicide and non-natural causes of death among our veterans. Our guest today is Charlie Hall, president of the Upstate Warrior Solution. Charlie and his team serve as the community lead for Operation Deep Dive in the Upstate region of South Carolina. Charlie, would you please take a moment to introduce yourself?
Yeah, thanks for having me, Cherie. Really glad to have the opportunity to speak with you and our guest here about the study and about suicide prevention. As you've said, I'm the president of Upstate Warrior Solution here in Greenville, South Carolina, not to be confused with any of the other 80 Greenvilles around the country. We serve a 10-county region in the Upstate. I've served in the military for just over 20 years. Got into this work coming through the Marine Corps' Wounded Warrior Regiment. Really having a great appreciation for working with folks that needed transitional services. I had a combat deployment in Iraq in 2004, and I'm still serving the U.S. Marine Corps Reserves. As a community-based nonprofit, our mission centers on three actions: connect, lead, and inspire. We connect warriors and their families with resources and opportunities. We lead them through the process of self-empowerment, and we inspire the community to embrace warriors as valued friends and neighbors. So Cherie, our work is built on face-to-face outreach and case coordination to assist with needs ranging from housing and healthcare to education and employment. One of the most critical issues we're working to address is suicide prevention, which is why we have supported Operation Deep Dive since its inception.
Thank you, Charlie. And I've had the honor of working with you for, going on 7 years now. And of course, we've known each other for probably 10 when you were, working, when you were still active in the Marine Corps. But like the past 7 years, you've been, Upstate Warrior Solutions has been an affiliate of America's Warrior Partnership Community Integration Program. And you've been an invaluable partner bringing Operation Deep Dive to the Upstate. So today we're continuing to discuss how everyone can support Operation Deep Dive and suicide prevention initiatives in their state. As a reminder, we will take questions in the chat. So please type them out in the comments section of this video, and we'll answer the questions throughout the session. So let's kick things off with a deep dive into South Carolina's veteran communities. We know that every veteran encounters different obstacles based on who they are and where they live, which leads to a complex network of issues that can be risk factors for suicide or non-natural causes of death. The mission of Operation Deep Dive is to understand these issues and challenges that are unique to a community, and more importantly, how communities can work together to ensure an upstream approach. Charlie, can you please tell us how the Upstate Warrior Solution is supporting this effort in South Carolina?
Yeah, absolutely, Cherie. So Operation Deep Dive consists of two components. The first component focuses on analyzing local data to help identify how many local veterans live in South Carolina, and then how many have died by suicide or a non-natural cause of death. The second component focuses on interviews with those who have lost a veteran to suicide or a non-natural cause in the last 2 years. For us in South Carolina, we're particularly interested in the second component. Due to state laws, we're unable to access data that tells us how many veterans died by suicide or non-natural death. Therefore, we have to get creative. So we're focused on meeting people who have lost a veteran to suicide or non-natural death in the last 2 years and interviewing them to learn how we can improve our upstate community. So we work with a great research team comprised of folks from America's Warrior Partnership and University of Alabama. The research team will use the insights gained by these analyses and interviews to determine how a veteran interacted with their local community before their death. Ultimately, these findings will help us create a more effective and impactful support program. This is particularly important to us at Upstate Warrior Solution because we look at veteran well-being through a holistic lens. It's the whole person approach. And knowing what areas our Upstate veterans need extra support in will allow us to form a more effective partnership, leading to more impactful support programs and initiatives within our overarching program at Upstate Warrior Solution.
Yeah, that you're getting upstream, everything you do supports that effort. And that's a goal that I believe every community can get behind, creating stronger ways to proactively empowering veterans before they reach a crisis point. Many times we get the question, how can community members help make this a reality? So the supportive environment for our veterans ahead of crisis. Can you address that now? How do you see, or how are you working in the upstate where people are living in South Carolina can contribute to Operation Deep Dive?
Yeah, so because I mentioned earlier, we've had some challenges with getting access to the data. We really had to use our relationship network in the upstate to meet people that have lost a veteran due to suicide or non-natural causes, and really develop a relationship with them so that we establish a level of trust so that they're willing to do an interview with us. The interviews will provide a clear picture of the unique factors that impact a veteran's well-being in the state. Ultimately, these interviews will be able to give us and other local organizations guidance on how to better direct their efforts, engage veterans, and enhance their quality of life. So if you aren't eligible to participate in the interview, I'd encourage you to share information about the study with your personal networks. You could give a close friend or colleague the opportunity to share their story and help reduce the likelihood of veterans dying by suicide in the future. So a couple of things. In addition to the study itself, our veterans and our warriors should also understand that there's a wide range of programs and services available to help them overcome a challenge. So this is kind of getting more on the upstream side, not necessarily the study itself, but understanding that in addition to things like the Veterans Crisis Line, you've got community-based organizations like Upstate Warrior Solution, you've got the VA, others that are really standing by to provide that holistic support. So, you know, the Veterans Crisis Line, I'll just state that in case some of you guys haven't heard of that or have a pen, but that number is 1-800-273-8255, 800-273-8255, and you can press 1. Or the VA's actually gotten pretty modern, and you can also send a text message, which is 838-255, 838-255. I do have knowledge of the Veterans Crisis Line working very effectively, so please use that. Please have those numbers in your back pocket. If you're in the state of South Carolina, specifically in the upstate, but anywhere in the state, you can connect with our team at Upstate Warrior Solution if you're searching for assistance with a particular issue. Our process for requesting support, as well as our phone number, email address, and office locations in the upstate are all on our website at upstatewarriorsolution.org.
Yeah, this is great advice for individuals. And a follow-up question I'd like to ask is, how can organizations get involved? You know, if one, excuse me, if one of our viewers works with a veteran organization or community group, what can they do? How talk to our viewers a little bit about how your partners help with that outreach effort that you were just talking about when you're building the relationships with veterans and finding them ahead of the crisis. How do your partners, how are they a part of your outreach efforts and that support, and how are they using or working with Operation Deep Dive to help you to find those individuals?
Yeah, so this study really moves at the speed of relationships. So, veterans, family members are not um, generally calling us cold to say they want to do an interview. This is a tough subject. There's a lot of pain and heartache, even decades down the line from this. So really, this is something we depend on community organizations to be some of our greatest supporters over the course of the study. They've got relationships with these veterans. The VA has relationships, all levels of nonprofit organizations across the country. They can really help amplify our call for interviews. Information about the study and all other resources also online. I encourage other organizations to share links to the Operation Deep Dive website through e-newsletters, social media, and even daily conversations with coworkers and partners. Another means of getting more involved is through your state's Governor's Challenge to Prevent Veteran Suicide. This is a SAMHSA-led effort. I'm not sure how many states are participating right now, but I know that North Carolina and South Carolina are, and I'm a part of the South Carolina Challenge. That's most of those Governor's Challenges are aware of this effort and aware of how to get people plugged in. And then something that we've been very involved with here in the Upstate is through our behavioral health coalitions that are really building momentum around the country. Those are facilitated by our local United Ways here in the Upstate, but that might be something that your Mental Health America or your NAMI or your local government mental health organization may be running to really try to leverage the community of partners for mental health concerns in the community.
Yeah, and but you've touched on other aspects as well. You're talking about the mental health community and supporters there, but also you've talked about other partners that you have, because it's going to take all of us, right? It's going to take our mental health providers. It's going to take our housing providers. It's going to take our employment providers. It's going to take our local law enforcement, EMTs. What makes up our entire community to be able to support getting upstream for our communities. So, and it will certainly take a community effort to end veteran suicide. It's all of our responsibility around that, and we're so very grateful for any support that individuals and organizations alike offer. I'd like to take a step back for a moment and talk about how to connect with veterans who may not be aware of the resources available to them. Upstate Warrior Solutions you guys have had remarkable success reaching veterans in the community before they reach a crisis. Could you tell us more about your team's work and how other communities may be able to follow your lead?
Yeah, absolutely. So like I mentioned before with the study, the way to get to veterans is really through relationship. Me being a veteran, it took me a while to actually go into the VA. I think Cherie might have actually tried to convince me to use some of the services that I rate. So in addition to the relationship piece, it's really about having networks built. Some of these networks already exist in the community. We talked about the Behavioral Health Coalition. There have been many homeless networks that have been built over the years. If you're familiar with the continuum of care, most communities have a continuum of care. So those networks are really vital. We've seen that there's been somewhat of a lack of networking in the behavioral health space. So we're excited about this study and some of these other efforts like the Governor's Challenge as well. We're also trying to find veterans where they are. So we're in their place of work. We're talking to law enforcement professionals, healthcare systems, and also higher ed. Most of your younger veterans are using their GI Bill at a 2-year or 4-year school. And these are veterans that are relatively well adjusted, but they just got out of the military. So they really need some early upstream prevention to help them get what they rate. We're also trying to educate community leaders on how they can help a veteran when they encounter one that has empowered countless other veterans to find the resources they're seeking. So that's something that we really are trying to get in front of our leaders of community organizations, colleges. Again, I mentioned law enforcement, healthcare systems, to think about how they can be proactive and reach down. Another huge component of this is remembering that veterans are everywhere and represent themselves in all forms. You can't simply look at someone and know they're a veteran. Not everybody's wearing that I served hat. Some do, but many don't. And, there's actually a formal Ask the Question initiative that's been deployed through the Governor's Challenge and through SAMHSA. And I think the VA is trying to work with community partners to really get folks to ask that question on their intake forms, wherever a veteran may come into a social services environment. Or for example, if a veteran gets arrested, saying, "Are you a veteran?" is not necessarily the question, but "Have you ever served in the armed forces?" is a better way to ask that. I'm still in the reserve, so in some instances I would say, "No, I'm not a veteran." Well, because I'm in the reserves, I didn't tell you that, but I will say, yes, I served in the armed forces. If someone is identified as serving in the military or as a family member of a veteran, you can get them connected to us as well as many other organizations around the country that are doing this kind of holistic support. We want to support veterans alongside other community organizations as well. We also need to remember that military and veteran families play a huge role in the success of the veteran. That's something that the VA simply does not have the capacity to serve families. I think they wish they could, but again, the veteran population is such a large group. It's really hard to get to those family members. So, my opinion is the community needs to step up and serve those family members. Family members, caregivers, they know the veteran's story. They know the challenges that are seen, but also the challenges that are unseen. And actually, at Upstate Warrior Solution, we have had a full-time family services advocate that works only with family members for the last 2 years. And she's been very helpful because she's been able to get us in front of some of these families that have lost their loved one to suicide or non-natural causes a lot more quickly because of her relationship with them. So look for organizations that have family support programs. There's some national, there's some local. And if there's a void in your community, consider stepping up and trying to fill that void.
Absolutely. Thank you for that, Charlie. And thank you guys so much for joining us today. We're going to wrap up with some final information around the interviews and how to participate in Operation Deep Dive. We are currently looking for interview participants who have lost a veteran to suicide or non-natural causes of death within the last 24 months. And you guys have heard me and Charlie say non-natural cause of death several times, and we haven't spelled out what that is. This is looking at what this interview is for those who have died by suicide, overdose, asphyxiation, drowning, high-speed vehicular accident, and suicide by law enforcement. So if you've lost a veteran within the last 24 months to any of those causes, we would like to interview you about the last 6 to 12 months of your loved one's life. The goal of these interviews is to understand how a deceased veteran was engaged within their community and how that community can better support veterans in the future. We have an eligibility criteria. You must be 18 years or older. You must have a relative, loved one, friend, or coworker who was a veteran and died by suicide or the other non-natural causes that I listed within the last 24 months. Both you and the veteran must have lived in the same community at the time of their death. Additionally, the community you and the veteran lived in must be in South Carolina or one of the 14 other states participating in Operation Deep Dive. Now, I know that's a lot to remember, but all of that information is on America's Warrior Partnership / Operation Deep Dive. So if you want to go ahead and you can type that in and you can see all of that eligibility and more information around that. Just to let you know, the other states that are participating in Operation Deep Dive currently are obviously South Carolina, but we have Alabama, Arizona, California, Florida, Georgia, Indiana, Kentucky, Minnesota, Nevada, New York, North Carolina, Ohio, and Texas.
I don't want to forget about Texas.
Yeah. Well, interestingly, you were telling our viewers about South Carolina. Texas has the same law that South Carolina has related to the data from the state level. So a couple weeks ago, when we did a Facebook Live, we had John Bursler from Combined Arms, and he was talking about that as well. So if you guys are eligible and you'd like to participate, or you know someone who may want to participate, please visit americaswarriorpartnership.org/deep dive to contact our team. Or if you just have questions, we understand that it might be scary. This is a very vulnerable conversation, and just because you contact us because you have questions or you might be eligible doesn't mean that you have to be interviewed. So please, if you have questions, contact us. Well, that's all the time we have for today. Charlie, do you have anything else you wanted to add, or you thought we didn't cover?
Yeah, I wanted to give a quick scenario about one of the families that we've done the study with. You know, there was some reticence early on where the family, there was still some rawness about, and it was an actual suicide. There was some rawness about that. And, you know, a year later, we've got a relationship with the family on many levels. The family has learned about things in the community that, you know, they had no clue about before. But that relationship piece is the biggest piece. And I think that's one of the biggest intangibles of the study is, yes, we've learned more about why their veteran took his life, but you know, we've really developed a strong relationship with that family, and they can count on us. They can turn to us. We have knowledge of a very vulnerable time of their life. So we're hoping to see that relationship built more and more times over as folks engage with the study. Even if they don't engage with the study, that's something that we want to be a resource and a friend, and really be able to show them respect in a very unique time of need. So I just wanted to kind of share that that scenario because we witnessed that and we saw the value of that from it. I did have we had one question that popped up as far as active duty and reservists. Can you address that, Cherie, and their eligibility?
Sure. So if you have served in the military, then you qualify, and you've taken your life by suicide or natural causes, you qualify irregardless of character of discharge, and it's active duty branches, but also reserve and National Guards. So it's not, if you have a loved one that served in the National Guard, in the reserves, or in our active duty at one point. Now, active duty, this is not about those that were currently active when they died. So when I use the word active duty, they were active duty at one point, you know, Army, Marine, Air Force.
Yeah, that makes sense because I think DoD would be looking at that holistically. So for a reservist who did serve an honorable term, I think they would qualify as a veteran because they may have taken their life while they're in the reserves, but they're still considered a veteran for VA purposes. Is that right?
Okay. Yeah. Good. Unless they were activated.
Right.
When that, but yes. Okay. So you can be in the National Guard or the reserves as long as it didn't happen during your active duty time, then qualify. Good question. All right. Well, if you have any more or you think of one like later on, feel free to continue to post in Facebook those questions, and we will provide you responses um, throughout the day. Um, Charlie, thank you so much for joining, me today. Always a pleasure, and you guys are doing such great work, and I think it's really good for our viewers to hear what's going on in the Upstate. So thank you guys for tuning in, and stay tuned in to America's Warrior Partnerships Facebook page for information on Operation Deep Dive discussions and updates. Thank you.
Yeah, thanks, Suri. Thanks, everybody.
Thank you.